Next, we'll have Dr. Mahesh Gopalakrishnan talking on national prevalence of diabetic retinopathy and blindness in known and unknown diabetes and economic implications. I've been asked to introduce Dr. Mahesh. I don't think he needs an introduction in Kerala. That is Dr. Mahesh Gopalakrishnan.
Good morning, everyone. Actually, 5-6 months back, Sheena called me and asked about why don't we have a symposium on, it is not an instruction course, it's something like a symposium on Smart India study. So I said that is a very good idea. In fact, we quote all the other studies like DRCR, NET, DR, this, that and all. Our own study, this is a huge study done in India, and which has, only if you cite it and quote it and then understand it, then only the value of the study goes up. So everyone should understand, at least they should have some knowledge about such a study is there, and we should quote it everywhere regarding the prevalence and incidence and all this stuff. So that is why we wanted to introduce this. It's a complicated study, I know, but after each talk, if you get 1 or 2 points from that, it will be very useful. So it's a very, and we are fortunate to have Dr. Rajalakshmi, who has put her mind and everything into this study, and then published more than 20 articles. No? How many? Yeah, so many articles. And just see this. This article was published in Lancet Global. So I am talking about 2 studies, 2 articles. National prevalence of vision impairment and blindness associated risk factors in adults aged 40 and older in known and undiagnosed diabetes. So this is the result that I am going to talk initially. So this was published in nothing other than Lancet. So that is the importance of this study. So already Juhi has mentioned the outline of the study, how well it was conducted across India in different groups with a good representation across. So till now we have only some old data like rapid assessment, avoidable blindness methodology data, all these data are there, but we don't have much of a details on undiagnosed diabetes also. And so that is why the aim of the study was to report the national and sub-national, the regional prevalence of blindness and vision impairment in known and undiagnosed diabetes. So let us go through some of the salient features. Why this study is important is, this gave the national prevalence of vision impairment and blindness among people with diabetes as 21.1% and 2.4%. This data is very important. So prevalence of vision impairment and blindness among people with diabetes. So just remember few numbers. That is all that is required. And the importance is undiagnosed above 40 randomly people were checked for HbA1c, and they also were included in the study if HbA1c was more than 6.5. All the protocols were kept, ICMR guideline, approval. It was a 20-center cross-sectional study, 1 area in each territory across India, and all individuals older than 40 years staying in that place for 6 months were included, and all diabetics, and randomly lot of non-diabetics also. So HbA1c was checked, and with a random sugar point of care kit, and diabetes was defined as more than 6.5 in undiagnosed diabetes. And vision check was done using a smartphone based app, and non-mydriatic fundus camera was taken for fundus evaluation also. Huge number, all participants, more than nearly 8,000 people with non-diabetes and undiagnosed diabetes were there. And these are some data. It's a very complicated study. In fact, to understand the whole thing, you have to read it at least 10 times repeatedly. So I will go through some of the salient features. By extrapolating the study results, prevalence of vision impairment is 21.1% and blindness is 2.4% in this group. That is one thing. So these were similar in that vision impairment and blindness were similar in undiagnosed and non-diabetes. That is another finding. That is people already non-diabetic and undiagnosed, that was diagnosed by blood test. So, and older age, lower educational attainment and unemployment were more related with this. Manifest signs of low socioeconomic status such as underweight BMI associated with vision impairment. So some few points which all of us know, but just remember the numbers. So there were lot of patients with ungradable retinal images due to cataract. So that is the importance of, still cataract is a important cause for vision impairment even in diabetic patients. So that is, so reducing cataract burden itself is a part of managing diabetic retinopathy, preventing diabetic retinopathy blindness. That is one other important outcome that came from this. And there is something called epidemiological transition level states. India is divided into different epidemiological ETL states, and based on that also some analysis was done. I will come to that. The important strength of this study is nationally representative data set and a large sample size, and absolutely perfect statistical weighting to ensure national representativeness. Cross-sectional nature is, as any study like this, it will be cross-sectional nature. So there are some limitation, and it did not recruit people younger than 40 years. So, and some patients with type 1 diabetes may have been included. Some small things, but it is quite okay. So, in conclusion, the 2011 census data we used underestimated the rates, because population also has grown over the last 10 years. Secondly, non-mydriatic retinal imaging was done, which underestimated the rate of diabetic retinopathy. And already blind people may not have been included in this study. So that is, these are a few things that are concluded. This study showed the prevalence of vision impairment in type 2 diabetes in India, especially low socioeconomic status. This is the take-home message in this. Now, the second study is prevalence of diabetic retinopathy stratified by known and undiagnosed diabetes and socioeconomic indices. This is the other part which was published in Lancet later. So I will just go through a few salient features in this also. Here, what is called epidemiological transition levels. Actually, in India, different ETLs are there based on the database. And high ETL means the non-communicable diseases are high. South Indian states are high ETL, right? South Indian states, unlike North Indian states. And this study analyzed the rates depending on the ETL, epidemiological transition levels, and socio-demographic index. So these two studies were taken. Parts were taken. So ETL is the ratio of all dailies due to communicable, maternal, neonatal, etc., etc. It's due to versus non-communicable diseases. High ETL state like Kerala have high non-communicable diseases, and SDI is expressed on a scale, and that is also I explained. So these two factors they analyzed in this study, and primary outcome variables were diabetic retinopathy and vision-threatening diabetic retinopathy status. So number of people with VTDR, vision-threatening diabetic retinopathy, was also. So the value of this study is, it showed that the prevalence of 12.5% for diabetic retinopathy and 4% of vision-threatening diabetic retinopathy. These two values, just remember. So that is it found the value like this, and it is low SDI and epidemiological transition level has lowest prevalence. Just like high, that means if the non-communicable diseases and high ETL states have higher prevalence, and this has importance in the allocation of funds. So it's as already explained, it's a multi-center study, and trained field workers have done all the this thing and screening of diabetic retinopathy, and these are the number of patients included in the study, and already that the methodology has been explained. So high and middle ETL states and have 3 to 4 times higher prevalence of VTDR than their counterparts. Secondly, they generally increased with age, and thirdly, non-diabetes approximately double observed in those with undiagnosed diabetes. So these are some of the findings. The prevalence of diabetic retinopathy has been always reported to be lower than global prevalence. In this study, 3 modified risk factors were identified: hyperglycemia, hypertension, and albuminuria. So in Kerala also, different projects have been launched. The strength of the study is very large sample size, and probably cross-sectional study is a drawback. In conclusion, the burden of VTDR is insignificant. It is significant. Future policies should consider the heterogeneity of VTDR burden, and fund allocation should be based on the ETL. So these 2-3 points, the incidence, prevalence of blindness in and vision threatening diabetic retinopathy, please remember and quote Smart India study everywhere possible. Thank you.
Thank you, Mahesh, for the effort you've put in. Yes, it is important because this study has a pan-India representation. Most of the other data that we have, Indian data, most of them are restricted to South India and few pockets of India. So that is why this was a very relevant study.